Oh, Renee. Anybody see Brian O'Connor? Oh, Brian O'Connor. Brian O'Connor, right there. Thanks. I'm trying to put you four at a time for the sake of this morning. Good morning,
everyone. Thank you so much for being here.
Not my. Thanks so much for being here this morning. We're so grateful to have you. The purpose of the meeting today, we are gathering to discuss the state of homelessness and lack of affordable housing, both the human impact and the economic impact. I'm very pleased because we have a pretty significant panel today. I am going to ask that my other chair, who is currently available, Jillian Gilchrist, provide some comments as well, but I would ask that folks keep the comments short only so that we can move on to our speakers. Our speakers will be speaking for about 5 minutes each. And then at the end of the human impact panel, we'll have time for questions. And then again, at the end of the economic impact panel, we'll have time for questions from legislators. So we're just so grateful that you're here. This is obviously an incredibly important topic. We're doing our best as legislators to try to come up with solutions that will work for the majority. And so I'm just, grateful to have you, Representative Gilchrist.
Great. Good morning, everyone. Thank you so much, Representative Cabros-DeGraw, and good to see my other colleagues and those in attendance. And also really happy that the Human Services Committee is a part of this conversation. We held a working group over the summer that looked at social determinants of health and how Medicaid might be able to play a role in addressing housing. It's one small piece, but I think it does take all of us to address this crisis in our state. And so just very much looking forward to the conversation today. Thank you.
Thank you so much. I do see that Senator Lesser has joined us by Zoom. So if you are prepared to give some comments, please do.
Thank you, Madam Chair. It's great to partner with the other committees here. And I'll echo my co-chair's remarks and just say that this is an incredibly important topic and one that I'm hearing about throughout my district and throughout this part of Connecticut. So I'm hopeful that we'll have a meeting of the minds of all the stakeholders here. I will just apologize, particularly for my Senate colleagues. There are a couple of other events happening at the same time. So I will do my best to be in multiple places at once. But if you see senators in and out, you'll understand.
I think we'll probably see representatives in the same boat. Senator Seminara.
Good morning, Madam Chair, and thank you so much for having me this morning. Obviously, this is an issue that is a huge crisis that has been presented over and over again, and this is certainly not the first year that we're hearing it. I am looking very much for, I've heard from many constituents that are suffering, and I am looking forward to hearing from all of you so that we can get some additional information in hopes to address this very important issue. Thank you so much.
Let's hear from Ranking on Human Services Representative Case, please.
Hey, good morning. And thank you for having this and putting it together. I did join Jillian on her working group, and more and more things come up, and they bottom down to housing and people having a good place to go home to. It expands their life and gets them to the next step. So I'm anxious to hear what we can do and look outside the box and how we can fund things.
Thank you so much. So without further ado, we'll start with our human impact panel with the CEO of Connecticut Coalition to End Homelessness, Sarah Fox.
My name is Sarah Fox. I'm the Chief Executive Officer of the Connecticut Coalition to End Homelessness. We work with service providers and partners and people experiencing homelessness every day, partnering together to solve homelessness across the state. I'm also a person who has experienced homelessness, and my mother lives in permanent supportive housing, and she also experienced homelessness, and I come from intergenerational poverty. I think it gives me a lens, unlike many others, as I know firsthand the impact of what it means to be unhoused, and also the impact it has on your ability to learn, your health, and just to be a citizen in a community. It is so challenging. So today, I just wanted to speak to you about what we're seeing across the state. Our state, like so many others, has been impacted by the affordable housing crisis. We are seeing a rental market like we've never seen before. And we have people staying in shelter so long that it's becoming home. It's causing us to have tremendous challenges. For those of us who have worked in this field for a long time, we know that we can solve homelessness. It's a simple math equation. When people come into homelessness, we either keep them out of the system by using diversion, or if they come into homelessness, we quickly move them out. Today, people are staying 180 days in some communities, 134 in others. We have babies being born in shelters across the state. And we also know that for children who experience homelessness, their mental health depreciates 50% on their first day in shelter. And then think about the impact for every day longer than one day. So as the numbers rise of people staying in shelter, and as it becomes increasingly difficult to move people into affordable, safe homes, we have seen an uptick in those people who are both calling 211, going to our hubs, but also remaining outside and unsheltered. Today, as of our last report on the 29th, which is a 2-week count of those who are verified unsheltered, we have 940 people across our state who were unable to come inside, even with the snow coming down, even when the governor said that no one should leave their home, who slept outside in tents. And those individuals are a huge concern for us. This includes 293 individuals across the state over the age of 55, 21 families with 36 children, and we saw our largest numbers in the state in Greater New Haven, where we had 285 people who were unsheltered. So when people say to me and they call me and they say, you know, I'm seeing a huge trend in elderly homelessness. I have people who are coming to my door, and so senior centers are calling. And they say, we've just never seen so many people losing their housing because they can't afford the rent for our senior populations. We have early care centers calling and saying, you know, I have a mom and her kids. She drops the kids off at school. She goes to work and then she's sleeping the night in her car. These are things we didn't see before. We didn't see the level of tents that we see in our communities today. Homelessness looks different. We know how to solve it. We must bring people inside. And it's also critically important in this crisis to recognize that we have close to 5,000 people currently on our statewide by name list and facing homelessness. This includes 501 families, 541 children, 1,164 seniors over the age of 55, and 351 youth between the ages of 18 and 24. They're not staggering numbers, but it is an increase from what we have seen. And we know that we have to put the measures in place to protect our families, to help strengthen our communities. And I will also say, just following the national trends, this is the same exact trend we're seeing across the nation. So this is not a Connecticut problem. This really has to do with an affordable housing crisis and an emergency care system, the homeless response system that has been funded by one-time funding that needs ongoing annualized committed funding to really be able to provide security for those facing a housing crisis and to quickly move someone out when it arises. Thank you.
Thank you so much, Sarah. And while it may not be staggering for us, those are certainly numbers that I'm sure have, while I've heard them before, I'm sure are gobsmacking some of my colleagues right now. So up next, we have two mayors of our cities here in Connecticut, Mayor Arunan Arulampalam of Hartford. I think I did pretty well. And Mayor Roberto Alves of Danbury. So Mayor of Hartford, if you wouldn't mind starting first, please, Mr. Mayor.
Yeah, thank you. Good morning, Madam Chair, and to all the members of the this committee. And I'll say, you know, Ms. Fox is a subject matter expert, so I won't repeat the policy points she made. But let me tell you from the ground, we have seen a staggering rise in the city of Hartford just in the last year in homelessness. And we see it in Hartford because Hartford holds 95% of the beds for a surrounding area of 34 towns. And so residents from all of your towns around Hartford, from West Hartford, from Avon, from Simsbury, from Glastonbury, from Manchester, end up in Hartford. And I see them in my neighborhood, on my street. And every single time that it snows or gets very cold, in my short time since becoming mayor, once I tuck my 5 kids into bed in our warm home, go out with PD or by myself and check at each of the fast track stations and under bridges and under highways just to see members of our unhoused population who are out there and to inform them of resources that we have and sometimes, put them in the car and take them there. Sometimes they want to go there themselves. But I'll tell you, when you become mayor, a lot of people like to tell you what the reality is in your city. And so many people have told me that if you are staying outside in the winter, that you want to be outside. And I will tell you firsthand, that's not true, that we do not have enough beds in Hartford to hold all of the homeless people in our city. And again, these are not just Hartford residents. These are sons and daughters of each of your towns. And this winter, people will die because of it. There are people who will die in the city of Hartford because they don't have shelter in one of the wealthiest states, in the wealthiest country in the history of the world. Right here in our backyard at Bushnell Park and at the fast track station and under our highways, people will die this winter. Every December 21st on the longest night, my wife is a pastor at Center Church in Hartford. They hold the longest night service where members of our unhoused population gather and remember their loved ones within the homeless community who have passed away. And this past December 21st, they read off the names of 56 people who had died in the city of Hartford. This is a crisis for our cities, and it's a crisis for all of your residents and people in all of your communities. And Hartford can't bear the weight of this crisis alone. We will do everything we can because I don't want anybody dying in my city because they don't have shelter. But we need all towns, all cities across the city across the state of Connecticut to work with us because people are dying within our community because they don't have shelter. Thank you.
Thank you, Mr. Mayor. Mr. Mayor.
Thank you. And out of respect on everybody's time, I'll echo some things, but not repeat it. Thank you, Madam Chair, for hosting this, and thank you for the rest of the panel as well. This is critically important. These are lives, and it's not that people will die. People are dying. And we had a homeless death in Danbury this year. It was 15 degrees last night in Danbury, and we have 38 folks on a waiting list. And that doesn't include McVinney-Veno stats. The homeless stats that we usually going through by the state don't include how the Board of Education counts as stats. And that's something important for us to talk about here and factor in on the need, because these are families that are doubling up, they're couch surfing, they're not counted in that traditional stat. But many of them are doubling up in Section 8 housing. And while, may want to look away as much as we can, we're at risk of having one family become two families on the streets if they get caught. This is a real crisis. And while Danbury's burden isn't as large number-wise as Hartford's, it's the same story as every city in our state, where we're the regional hubs for the towns. We're not getting the resources from the towns, so we need to come to you. We need that help. The cities are doing what they can. 2 of our city shelters, 40 beds only, cost us over $1.2 million to run a year. That is a sizable chunk for a city to take on. We find creative ways, we get grants, ARPA that is ending and we don't have after this year. So we really desperately need help. And that doesn't include the other programs where we help out. In Danbury, we have Harmony House, Amos House, the Center for Empowerment and Education. Each one of those programs, about 20 beds for women and children. One of those programs, we had to interject $60,000 just recently and $72,000 in December to help them with operating costs because they were getting ready to not be able to house folks. That would only grow to the crisis we're having here. It's no secret. We need help. And I know we have done some really smart financial things in Connecticut, and we need to continue those. But we also need to understand what the downstream effect of not investing in this right now. We lose lives. There's immediate triage we need, but we also need other things, not just beds. We need caseworkers. We need help transitioning folks out of homes. We need to, again, respect that the cities are the hubs for this. There's that scary word that we hear every so often, regionalization. And I understand serious regionalization will never happen in Connecticut, but we've regionalized social services because the towns that are around their cities come to us for our rehab centers. They come to us for our drug treatments. They come to us for mental health facilities. They come to us for behavioral therapy. They come to us to help with their homeless. We need help, and we need Hartford's help. And I appreciate the opportunity to speak on Danbury here. Whenever we can be a partner, we will. Our residents want to help our homeless folks, but there's only so much they can do. And we're here to be a part of this as a team, all the cities. We want to talk about our reality a little bit. When we ask for funding for 40 beds and only get it for 20 beds, that's a challenge for a community like ours, who's, you know, one of the fastest growing communities, immigrant populations in the state, fastest growing school system, 1 or 2 at Stanford every year. So people come to us, but now we need, you know, the state and the surrounding towns to help us serve their children, their mothers, their nephews, their nieces who desperately need our help. So thank you for the opportunity to.
Thank you so much. And before I introduce our next panelist, I think the way I had set this up was a tired brain operating. So I think it's probably best for when you finish, Brian, that we'll have questions from our legislators while the 4 of you are still here. So in the interest of logistics, that you're not having to get back up and down. So next up, we have Brian O'Connor from CCM, please.
Thank you very much, Madam Chair. Again, Brian O'Connor, I'm the Director of Public Policy for CCM. We represent 168 of 169 towns in Connecticut. And, you know, I just want to point out, you know, just, you know, to respond to, you know, and kind of echo what the other 3 panels have said, is that, you know, this is a crisis. This is something that CCM in the past, it's been a little bit dormant. I have to admit, we were more active during the pandemic. We had a mayor's task force on homelessness, which I think worked well. I think it was kind of a rapid response during the pandemic, where we helped the unhoused get into shelters, whether it be converting at that time underutilized hotels into spaces for our homeless population. And I think that's something that maybe we can replicate. I know there's some towns that have, you know, reverted back to the current zoning, but that's an area that maybe that we can look at as a potential solution to this, to provide more beds. And speaking to what the mayors have said about the surrounding communities, I think that's kind of where there's a greater recognition, but at the same time, we do have members that don't think it's really their problem or first selectmen. And it's something that I think we need to address as an organization, as far as just getting more awareness, but also seeing what we might be able to do. And, you know, we hit some roadblocks with that mayor's on task force on homelessness. In achieving that, I think that's where the former Mayor Bronin kept pushing on that. And, you know, there was some progress, but not enough. And I think, you know, I stand before you here today to, you know, help find that solution, work with our partners, both, you know, our larger urban communities, but also our smaller towns, to see what we might be able to do to make that headway and resurrect the mayor's task force on homelessness. Because I think, again, it produced some positive conversations, also working with the cans as far as, you know, making sure that we're doing all we can to address this situation.
Thank you so much. So at this time, I would absolutely take questions from my colleagues as well. But I just wanted to start with, especially since we have the 2 mayors here, what are you seeing in terms of veteran homelessness? And maybe Sarah could also answer that. But are you seeing an uptick? Because we previously were very proud as a state to say that we've ended veteran homelessness.
I mean, I can speak to it anecdotally. I think, you know, Mayor Alves alluded to this when we think about homelessness. Oftentimes we think about the people who are on our streets and using our shelters. I've heard so many more stories of people's parents moving in with them, folks who had homes or apartments and are now staying with a loved one who are members of our veterans community. I think it's harder to see, and it's a kind of homelessness the cans don't always pick up. And there's a certain pride, I think, that comes after a certain age, that makes it harder for certain people to rely on the social services that exist within that city. I have anecdotally heard of an uptick in veteran homelessness. I'm not sure it's the kind of thing we can quantify as a city.
I echo that. Danbury does have a small veterans only shelter. It's been phenomenal. It was a successful model that we've talked about nationally. This is long before I got here, and we actually are working with the folks who created that to make sure that there isn't a need or try to help other communities if it's feasible. We have a great veteran outreach community in Danbury. They've always done pretty good to ensure that there is nothing new there. I can't look at you right now and say anecdotally or not if there is enough if we haven't. But what ties into all this, and not just veterans, is, you know, we talked about homelessness, it's affordable housing as well, right? We need to build more. We need more affordable housing, and that affects everybody, veterans included. So that's something else we need to talk about here, because this is a crisis that we got to connect all the dots, right? It's what happens. And I just read a great article about a city in New Jersey that it was cheaper for them to give $200 for folks who are going to be $200 short on their rent than it is to house them permanently, not permanently, but through homeless situations. So we got to connect our dots for all kinds of housings here in Connecticut.
Thank you. Question? Representative Hughes, please.
Thank you so much, Madam Chair, for convening this critically important and timely discussion. I'd like to ask the panelists what I'm hearing, and I'm hoping that this forum really helps amplify, is a collective responsibility across the state for the crisis we're seeing. What I'm not hearing, and I'd like to delve into a little bit more from Brian, what do you think the solutions are right now?
I apologize. What did you say at the end there? What the solutions are right now? Okay.
Yeah, thank you.
You know, I think, you know, short term, I think, you know, looking at supportive housing and providing cities and towns with resources, I think that's one of the things that they can't do it alone. They need the state collaboration to do that. And, you know, what we're seeing more of is, you know, at least, you know, what I'm hearing from our members, even the smaller, you're seeing more families. You know, we already knew about the veterans, but I think now you're seeing more families because of the high rents. So I think some of that we can't control. There's external factors such as, you know, the increasing of rents due to, you know, the lack of basically inventory on the home buying side, home selling side. But it's you know, again, I'm going to go back to the hotels that maybe are, again, underutilized. That might be an avenue for housing housing the homeless, because I think that's an area that it worked. We saw that it was a model that worked. And again, I know that won't go without maybe some of the neighbors and some of the, you know, interest groups that might be fighting it. But I also think it is a part of the solution.
I think we're hearing that over and over for sure. So Representative Weir.
Thank you. I have two questions. First is for Ms. Fox. I missed, you gave two populations of people. The first number was 940 of unsheltered. And then there was a second number in the thousands. And what does that population represent? I missed that.
That's data from our community by name list, which is in our homeless management information system, which is a count of close to 5,000 individuals who are experiencing homelessness at this point in time and are in need of a housing resource. So you have people who are outside, who are unsheltered and verified unsheltered, who are not counted in who are counted, but we as a state have not done an incredible job making sure that people who are outside are on our by name list. So our communities led a process to verify unsheltered homelessness. And so it's not perfect, but those are community, that's the community list of people who are verified unsheltered in each of the 7 coordinated access network regions across the state.
Thank you. So that roughly 5,000 unhoused, and then another 940 of unsheltered.
So there are some of those individuals who are on the by name list, but it's not one-to-one. So what we found was that our by name lists were not an accurate depiction of the amount of people who were outside. We are actively working to make sure that our outreach has the capacity to verified unsheltered homelessness better and make sure people are getting onto the list, but they all were not. So we led a separate process to make sure we understood who was going to be outside this winter. So the 5,000 are people who are in our programs across the states and are targeted for some form of service. And I could just add there, you did ask a question earlier, Representative Cavros DeGraw. There's about, on that BINAM list, what it shows, as of last week, I believe, is 354 veterans who are currently experiencing homelessness.
Okay, thank you. I'm sorry, go ahead.
It's more of a global to the group. If you can help me with this, sitting on the housing committee, we have some proposals that are going to deal with homelessness and unhoused. I've heard some short-term suggestions. I recognize that you've got a group of people in the over the 55 and elderly. So maybe the long-term solution is to continue supporting them. If you've got somebody 70, maybe they're not going to go, I guess. What are some long-term solutions and long-term support? Once the kind of the immediate need has been met to get somebody sheltered, what is the long-term continue to support them and maybe break that cycle of any suggestions to break that cycle and get them self-dependent?
I can.
Sure.
I mean, we have had tremendous success as a state in housing our long-term homeless and disabled, that's our chronic homeless population, through really making sure that we had enough permanent supportive housing units available. And that requires also case management services to be provided. And if a person chooses, a person can choose not to utilize the services, but for the most part, people do choose, but we need to have case management services available and funded for people to be successfully housed.
I appreciate the question, Representative Ware, and my remarks initially were focused really on the short term in this winter. And let me make 2 points. One, the cost of addressing homelessness is going to continue to rise because the trajectory is moving in the wrong direction. Our homeless population is growing, and there's a study that suggests it costs 3 times as much to address homelessness as it does to prevent homelessness. And Mayor Alves spoke to this, but creating flexible housing dollars that allow for communities to prevent homelessness, I think, is really important in the long term, because I think all of our communities that are hit with the challenges around homelessness would be willing to address proactively and so deeply want to address proactively the root causes of homelessness to prevent families from ever and individuals from ever falling down that route. We also, one of the things in Hartford that we have noticed is we need more supportive, long-term supportive housing, but there's a donut hole between supportive housing and owning your first apartment, and especially paying market rate on an apartment. And we're working on trying to develop micro units that would allow for someone to, at a price point kind of in between zero and the going rate for an apartment, which right now in Hartford is over $1,500 a month, to live in a space that would allow them to graduate, to get their first job, and kind of work their way back into society. And there aren't housing dollars focused on that donut hole. So we're going to try to stitch together different solutions and have to deal a little bit with our zoning within our city, but stitch together different solutions to try to develop that housing. But being able to create the entire ecosystem so that we're catching people on the way down before they become homeless, and that we're creating the step in between supportive housing and a full apartment at market rate, to ensure that somebody can step their way back up.
I'll be quick because it's echoing a lot, but it's back to what I said earlier. We got to connect the dots, and it's going to be easy to say here and say we need resources. We do need resources, but the resources have to go beyond triaging the immediate. And I just wanted to say again, with caseworkers, we have very successful nonprofits across our communities, across our state, that have a tremendous track record of housing people, right? And you talk about diversion methods. We have to get there as we address the homeless crisis now and the affordable housing crisis. Make sure all the dots are connected and the resources that we desperately need are going everywhere. And nonprofits not being adequately funded or not where they need to be really hurt us and put us here. And we are breeding funding right now across cities with expiring funds that are gone at the end of this year. Everybody knows, though, communities' ARPA funds have to be encumbered by the end of this year. Right? So we may have another year and a half leeway after that. But if we don't get some help now, the problem is only going to be worse. So I know you know the levity of the situation. And one stat, if I may, because it's always best to put a face to it. And while we don't have the faces, we have a lot of people here. Raise your hand, panel, or people behind me, if you have school-age children at home, right? I have school-age children at home. We probably have about 100 people in this room. In Danbury alone, there's 81 school-age children that fall under the McKinney-Vento stat. 81 children, that's this room. This is the help we need.
And I was just going to make one final comment on that. I think, just to kind of follow up on what the other three have just stated, the case management services are very important. I think it's the next step there where, where there's a gap is that the fact that there's more workforce training that needs to be done. I think because you need a permanent solution, you need someone to be able to afford, their housing, whether it be their first home or what have you. There needs to be that next step, because I think case management goes so far. You got to get them a good job, and I think part of that is just getting some skills and training. You'll probably hear from CBIA later. There's 100,000 jobs that are open. Let's see if we can get that to the next step.
Thank you so much. And before I call on my next few colleagues, I just would ask that we try to keep the answers a little bit brief and questions brief, only because this is the first half of our first panel. Representative Gilchrist.
Great. Thank you so much. This question is for Ms. Fox. We're hearing a lot about the importance of case management. Could you give a quick 101 on what case management is? How many case managers you have per person in the various across the state, and then how much are they paid?
I was always told, don't give numbers that you don't have. The ratios, I think, are a little bit more difficult to get to, although what we're hearing is that, especially the overnight shifts at our shelters are really hard to staff. And we have many, many, many positions that are not staffed currently across the state because it is extremely hard to find staff who will work for very low wages. And what we do know is, after looking at the numbers of those staff who are employed within the homeless response system, that approximately 82% of them do not make enough to earn a one-bedroom. And so that's about $26 an hour. And you have many, many who are earning just around $18 an hour. So we have multiple staff people, many staff people who are working 2 jobs just to make ends meet, and who are primarily women of color. And that is something we don't have a strong stat on, but that is something that is shared by every provider across the state. So no provider who I'm working with, everyone shares the same sentiment. We have staff who are leaving us to go to Target, who are finding jobs at McDonald's, who are unable to make it work. We have many staff who are falling into homelessness themselves.
And thank you. And quickly, just examples, what does a case manager do?
So a case manager, and when we talk about the homeless response system, we're talking about a system of care that should be equated to a hospital setting, because they're providing immediate services to address people in times of crisis. And they are, and they are not, and so many of them are either they're talking to people on the phone and trying to keep them from coming into our system, or they're providing one-on-one services in shelter and meeting people's basic human needs. And people come into homelessness many different ways. So we have, people with severe health issues. You have people with severe mental health issues, substance abuse issues, and people who are aging. And so, and many of our providers across the state are reporting that the aging population is increasing. And so they're not even retrofitted for the right, to have the right services in place to serve the population as it is coming in. And so case management takes on many different forms, but you need people who have high levels of training, who are highly skilled to meet the needs of this population.
Thank you.
Thank you. Representative Dubitsky. You're still on mute, Rep. Dubitsky.
Sorry. Thank you. Thank you, Madam Chair. And thank you, mayors, for coming in. I have 2 quick questions. I know some of you have touched on this a little bit. I certainly would not doubt that there is some type of crisis. My question, though, is what is driving this crisis? We do a lot of talking about what needs to happen to get people into housing. Why are they not in housing to start with? Is it an increase in drug use? Is it rents that are going up? What is causing this crisis?
Thank you very much, Representative Dubitsky. At this point in time, what we know is that we are facing an affordable housing crisis and a rental market crisis that we have not seen before. So pre-pandemic, we were able to move people out into available rentals. Today, we have people with vouchers in hand who remain in tents across the state. It's really hard to find any form of housing for any Connecticut resident, especially for those who are severely cost burdened. So we know we need, and people will get to this much further, but we need 90,000 affordable units across the state. You need to work 2 part-time jobs to make it work on a one-bedroom work on those salaries. And so it's really not an easy thing for anyone to find available housing. And that's, what we are hearing is really leading to this rise in homelessness and why we're seeing moms in cars and families and elderly coming into homelessness in rates that we had not seen prior to the pandemic.
Okay, so you're saying that housing is too expensive.
I'm saying that we have a shortage of housing units and it is also too expensive.
Okay, why is it so expensive?
Could I give you an example from Hartford? Right now, if you look at housing in the cheapest part of our city, in the north end of Hartford, the HUD market rate for housing is about $1,600 a month. And so if you're earning minimum wage, $15 an hour, the first over 100 hours that you work every single month, before you pay for taxes, before you pay for food, before you pay for medication, goes into housing. And so for a single mother who's trying to take care of a family, for someone who's trying to get back on their feet, you can imagine how expensive, how much of a burden that is. I mean, that's more than my mortgage. You can imagine how much of a burden that is on the average family in a place like Hartford. And those rates just continue to rise.
Why?
I think you might need a national economist for that.
Well, has there been any discussion with the people who own this housing, the landlords, to see if there's any policies that the legislature could enact that would allow them to reduce the cost of housing?
Representative Dubitsky, with respect, I would say we are doing a second half of the economic impact with more discussion about affordable housing. So maybe some of these questions might be better served there with those experts. Well,
I'm asking the mayors, they're saying that this is the problem. So I'm asking if they can tell me if there've been any communications with people who if
you
provide
look at
housing.
Again, if you look at the north end of Hartford, in most of our neighborhoods, over 50% of those landlords live outside of the state of Connecticut. So if you're able to catch them to get a conversation with them, I'd love to be part of it.
Okay. Thank you very much. So you haven't spoken to them.
I think
Danbury, we talk to landlords all the time. We don't set prices on rent, Representative. I can agree with you. The rent's too damn high. Yeah, it is. But I promise you, we're looking at every aspect, but there's folks dying and homeless. So there's a real crisis.
Okay, thank you.
Thank you, Senator Seminara.
Thank you, everybody, for your ongoing communication. This is for Sarah. We were speaking earlier about case managers, and you were saying that they require a certain level of expertise. I'm interested to know the case managers that you do have on hand. Who are they? Like, what is their training in? Because you're saying that they meet the most basic needs, trying to meet the most basic needs of the people that they're serving. But I'm wondering, do they have any training to go beyond meeting the basic needs? I recognize that you, of course, have to meet the basic needs first and foremost. But I think in an effort for prevention and an effort to move out of that, you're looking for people who may have expertise in employment opportunities or preparation for employment, vocational training. So I'm just wondering what exactly is the expertise of the case managers?
We have people within our sector with all different levels of expertise. But what we really are facing is a workforce that is undercompensated, that where it's really hard pressed to find people with the level of expertise necessary. Many of our employees spend a short time with us and then move on to state jobs. And so you'll have people who are really dedicated, but they're not going to stay within the homeless response system and be at the risk of homelessness themselves. And so because of the ad hoc one-time funding we have received and the lack and the chronic disinvestment in our frontline providers, we do not have the workforce today that I think we need. What we do know is that when the homeless response system works well, when we stop all people from coming into homelessness who have any other resources, and we're quickly bouncing people out into housing. That's not the reality today, and people have higher levels of needs. So across the community in our CAN hubs, providers are working closely together to identify all other resources, including workforce. But what we're hearing from our shelters is that their workforce has to meet the needs of people with really complex challenges, and that they do not feel that they have the staffing equivalent or the pay to give people to really have the expertise to do that work. And so we have a mismatch today that we didn't honestly see before, because people were moving much quicker through the system, and we didn't have the level of acuity that we have today.
Agreed, but I know at a time we were moving people much quicker from the homeless system into something else. But I guess what I'm trying to address, or at least bring awareness to, is the sustainability of that. Okay, once you move out of that system, if you're fortunate enough to get out of that system, it's the sustainability to be able to stay out of that system. So that's really what I'm trying to heighten awareness to. Thank you so much.
Thank you. Representative Case.
Sorry, Madam Chair. I saw somebody else up there. Hey, so I just wanted to talk about a few things real quick. And I think, being in the northwest corner, we talked about this, and the encampments in the woods are growing. I found out last night. I mean, the amount of people coming into our CAN facilities and doing their intakes, getting new tents and getting out there is growing. But I think the biggest problem is, and we do things reactively, and we just did it on Wednesday. We ran out of money in light heat. We go in, we put more money in it. I've been asking this since October. We have vouchers for people who are in shelter, but the vouchers don't meet the needs for the rents. So the vouchers expire and they move to the next person, but that next person can't get the voucher to meet the needs of those rents. Let's do something now, because April 15th comes around when these cold weather shelters close. Where do these people go? Let's get these vouchers fixed. Let's get people where they need to go, get them services so they can get back on their feet, get a job, and start paying rent. I understand the situation with rents that have increased. That's a private industry. In the northwest corner, we have set up meetings with realtors. They've brought places to us that we can use, and that landlords that will do it. So we have those informational breakfasts with realtors up here. They have to start thinking outside the box, but we have to get people into these rents that are going to be sustainable and that they're going to take care of the places. So that's just working with the social workers and everybody else within the CAN program to make sure that people understand their responsibilities when they're in these rents. But that's all I have to say. The bottom line, we got to work on these vouchers so the vouchers are useful instead of expiring. Thank you.
Representative Brown.
Thank you, Madam Chair, and thank you to the panelists that are here today. This question probably is best directed at the mayors. We've kind of danced around a little bit and talked about the impact on young people, students, and vulnerable populations, but students in particular. Schools and school funding always being a big issue in this building are one of the first places where we often identify homelessness. When working with the families, we find out, as a classroom teacher myself, we find out that a student is experiencing homelessness and needs resources. And so we direct them to the social work office of our school, and it goes from there. What are you hearing from your superintendents as far as what they're needing to be able to address this issue as it's increasing in your cities?
Again, and hate to just keep saying the same thing, resources. It's resources, it's equitable, fair funding. And I know we've worked towards getting that a little bit faster through CS. But you're so right. We identify so much need from the school population. Some of those kids, the only time they eat is when they're in school, right? And a teacher, you see it. You see who's attentive, who is learning, right, and who isn't because they're hungry. So a lot of the stats I did get from partnering with our health director and our school board, because that's who I go to when you want to get those families. Because when we talk about homelessness overall, you don't tend to use the McKinney-Vento numbers that the Board of Education uses. And I think it's important when we talk about the homeless crisis that is the number we're going by, because it grows much larger. It puts a real picture on it when you put a child's face on that.
And I'll just say briefly, this is a point in which I think collaboration has been growing. I actually just this morning had a conversation with Deputy Commissioner McGee at Housing about connecting the state housing with some of the work we're doing around Opportunity Youth, and being able to have coordination around when we identify children who have housing needs, and that's a barrier. It's also as you know, I'm sure from the classroom, one of the driving causes of kids not wanting to talk about that openly is fear of the DCF system. And we've had a great relationship both with Commissioner Durantes and now with Commissioner Hill-Lilly. And I think it's something that DCF is very attentive to. And I think that collaboration that has really helped our city a lot.
Thank you. And I realize that I do have two more colleagues that want to ask questions, but I would just ask that you hold those for the second half of the panel. Thank you so much, the four of you. At this time, we would ask our next four panel members to come up. Carrie, the Commissioner, Chelsea Ross, and Joseph Shivitz, please. I think Joe is joining us on Zoom. I have not forgotten you, colleagues. Carrie Howe, are you here today? Carrie, on Zoom? Okay, great. Carrie, you are up first, please. That's it. Brianna, is she on Zoom? Carrie, is she on Zoom? Yes, sir. Okay. I think we may be missing Carrie Howell this morning. So Chelsea Ross, if you wouldn't mind starting us off. Chelsea joins us as the Executive Director from the Partnership for Strong Communities. I'm so sorry. I did that backwards. Actually, Commissioner, it's you. Commissioner Salem Mascaro Bruno, please, from the Department of Housing. I'm so sorry, Commissioner.
Oh, no. Please, Chelsea, go ahead. Good morning. Thank you, Madam Chair. Thank you, everyone, for being here and for inviting me to talk to you. So I'll go briefly what we have been doing in trying to really respond to our issues on the homelessness side. And the answer is housing, right? More housing, more housing, more housing. So in the first term, under the Governor Lamont, we built and rehabbed about 11,000 units, even with the pandemic, because the governor made it a priority for the construction to continue on. Right now, we have about 4,000 units on the construction. and also some preservation that we're doing, as well as about 3,000 units that are on evaluation. So our priority is to keep building housing, and especially to those income brackets between 50% of AMI and below. So our programs really funds those projects that come in with about 80% affordable and 20% unrestricted, because we do not want to concentrate poverty. So we have our nonprofits, for profits, working with them, and nonprofits, we are providing resources so that they can be a little more expeditious with the projects that they have in hand. So that's in the development side. We have also been working with some cities in acquiring hotels. In Hartford, there is a hotel that has not been open, but will be in the next couple of weeks with additional 70 beds. And that is the Days Inn. We partner with CRT, and they are going to be providing in the first floor services, which is very needed with mental health, addiction, and vocational training. In New Haven, we supported the mayor that he acquired, the city acquired another hotel wherein we provided the resources for the capital improvements as well as the operation for the next 2 years, so that they're actually providing the services, again, mental health, addiction, and some workforce developments. Unfortunately, in Danbury, we provided funding, and there is an empty hotel that a nonprofit acquired, and they have opposition from the residents, and that hotel is empty without having, which is sad, to have about 80 units just empty. So for us is that we are providing all the support we can to our municipalities, to our towns, but we also need them to really work with us, and the collaboration that we need to form. With the homeless system, we provided a couple months ago about $45.8 million, 16 million additionally of what the system used to receive. And that is because in October, I took the time to meet with all the service providers across the state. We met with about 200 service providers. And one of the issues, of course, always is that they needed more capacity, they needed more resources. In addition to here that they really like the hubs. Last year we provided a little bit of resources to open up hubs. And that was in addition to 211, so that a person actually can go into a place and being able to talk to a caseworker and work in maybe diversion and whatever else they needed. So our funding that we provided, the 16 million additional, was 3 million additional in operation for the shelters, and 6 million for the hubs, so that they can continue and increase the supports. There is a need for more services, as it was stated before. Mental health, addiction is a big issue. So what we're trying to do is, with the form of the interagency council that the governor announced a couple months ago, the goal is to work together with all my colleagues, because we alone, we cannot end homelessness because we have other resources. And the goal is to coordinate with all the agencies and the resources that we have, because one individual might be touched by several agencies, and we're not working in a way that is more comprehensive. So what we're doing right now, we have a small group, working group, service providers and frontline workers, as well as lived experience, working in how can we improve the system and eliminate some of the barriers that we have. That group will inform us in the agency council, as well as an advisory group that we're forming, that will be working with us, with the end goal that in the end of the summer, we'll have a plan that we can present to the governor, with not only how can we coordinate, but what else is needed, because there is a gap in between the homeless system, because some of your colleagues have come to me and said, well, somebody came to me and a 211 told them that they have to be homeless in order to be helped. Well, there is a gap, because that system was formed to respond to the homeless people, right? But we don't have the system to respond to the people that are about to be homeless.
Right.
And that is a big gap. So we're trying to figure it out, that by the end of the summer, we have a plan in what are the resources that we will need to bring that gap together. So I'll give you just one example before I finish of what we are doing in prevention, because we usually don't do prevention. We respond to a crisis. We have a program called Head Start on Housing, talking about vouchers. Head Start on Housing is a collaboration with the Office of Early Childhood. If a kid is in Head Start and a family needs housing, that they're in a crisis before they go into a shelter, they don't have to be in a wait list. We will respond, we will provide a voucher in real time so that that family can be stable. Today, we have housed about 61 families. This started last year, and about 125 kids that did not go to a shelter. So that's the type of programs, thinking out of the box. And it's the first in the country that we're trying to implement. So the next step is to also work with the McKinney Bento, which are the kids in the school system. Okay, I will end there. Otherwise, I'll keep.
Thank you very much. Chelsea Ross, if you'd like to go next. Chelsea Ross is joining us from the Partnership for Strong Communities. She's the Executive Director. Thank you.
Thank you, Madam Chair, and my representatives. So thank you for your leadership. At the partnership, we've spent 25 years shaping solutions to housing issues in Connecticut. We're a statewide nonprofit advocacy, research, and convening organization. And we work to impact change for individuals and families across the housing stability continuum. So that includes people who are experiencing homelessness or who are otherwise unstably housed, living in temporary, unaffordable, or unsafe housing conditions. So I started my career working in homeless outreach services and community case management. So your question about, what qualifications does a case manager need? And, while all the folks that I worked with in these roles were facing significant and unique challenges to their housing stability, the common thread was the availability of affordable housing. So that's why I do what I do today. The scarcity of affordable housing in our state lies at the heart of our homelessness crisis, which you've heard today, condemning thousands of individuals and families each year to those harsh realities of life without a home. So without adequate affordable housing options, we perpetuate this cycle of suffering and instability that denies our fellow residents the basic dignity of a place to call home. You've already heard that solving homelessness is inextricably linked to addressing our underlying housing shortage and affordability challenges. So without addressing our unhealthy housing market, we're going to continue to pour significant resources into managing people's housing crisis versus providing them a home. You heard from two of our mayors on the costs of providing these emergency services. So more than 119,000 renter households in Connecticut are severely housing cost burden. So that means that those families spend more than half of their income on housing costs. And half of these severely cost burden households are Black and Latino renters. Sarah mentioned the housing gap in Connecticut. So Connecticut has a gap of approximately 92,500 affordable homes just available to extremely low income renter households, those who are earning between 0 and 30% of area median income. So that's just to provide enough housing for those folks. And a large proportion of the individuals and families who are experiencing homelessness fall into this income range, as you would expect. So those are folks who don't have the wages or the financial cushion to recover from an unexpected medical bill, job loss, or many of the bumps that life has in store for each of us. 70% of these extremely low income households are either experiencing homelessness, unable to find housing, and for thousands, they're stuck paying above an affordable rental rate and teeter on the brink of eviction and possibly homelessness as we talk about prevention. So as the commissioner said, we know we need more homes in Connecticut. We need all different types of homes. We need homes at all different income levels and in all different communities. But what you also know is that developing housing takes a while and it's expensive and it isn't always welcome in every community. So the commissioner, the Department of Housing, the Connecticut Housing Finance Authority, and many partners here today are working hard to accelerate the timelines on development, reduce those costs, and encourage more communities to accept affordable housing. and create as many homes as possible. But in the meantime, we have to prioritize the expansion of rental assistance programs to meet the immediate needs of our most vulnerable residents, especially folks experiencing homelessness. So our state-funded rental assistance program, or RAP, is a lifeline for these folks. The commissioner mentioned Head Start on Housing. Head Start started pairing RAP vouchers with services as Head Start began. So RAP vouchers provide, they subsidize a portion of a household's rent, adjusting with changes in household income to maintain affordability. So that donut, right? Housing subsidies can help plug that donut. They provide immediate access to stable housing for individuals and families who are otherwise stuck in shelters, and they break that cycle of homelessness. I think Representative Tubitsky said, what's that root cause? The root cause is an affordable home. So providing a voucher to make that home affordable really helps address that root cause. And for many, RAP vouchers are paired with wraparound services that Ms. Fox talked about, supportive housing, to address challenges the person or family is facing beyond housing affordability. RAP vouchers don't just serve people experiencing homelessness, they serve other highly vulnerable populations who are at risk of homelessness, veterans, folks with child welfare involvement, people involved in the justice system, people leaving nursing homes, people with disabilities. So this really ensures that these folks can maintain stable housing and avoid the significant trauma of homelessness. So we talked about how is it sustainable? Well, because it adjusts, it stays with people as long as they need it and at what level they need it. And as we navigate these complexities of our housing crisis, we really have to remember that it's not just about numbers and statistics, although those are really important. It's about those people who are facing unimaginable challenges. So as I work on the policy level, and as my kids say, I do Zoom for work, I don't forget about my experiences working with people experiencing homelessness as to why I sit on all of these Zoom meetings. So, together we really have this opportunity and this responsibility to confront these dual crises facing our state. The economic challenges that you'll hear about our housing market, we've long since moved past the edges of affordability, and now housing is just completely out of reach in our state for thousands. And the human toll of housing instability and homelessness threatens the very fabric of our communities. So we are working together to confront these crises head on, and we need your support to ensure that no one is left behind. Thank you.
Thank you so much. And for our final member of the panel today, Joseph Shiavitz. He is joining us via Zoom, and he is a policy analyst for the Council of State Governments. Talking about
good morning.
11 waivers. Sorry, mouthful.
Good morning. Yes, my name is Joseph Shiavitz. I'm a housing policy analyst for the Council of State Governments in our Eastern Regional Office. I thank you for the invitation to testify today regarding Medicaid 1115 waivers. In the last few years, the Centers for Medicare and Medicaid Services have published guidance on their evolving efforts to address social determinants of health and health-related social needs. They describe housing as both of these things and have increased the array of services that can be funded to support housing stability. Section 1115 waivers are not the only means to fund housing services through Medicaid. However, they are intended to allow states the flexibility to design experimental housing programs in order to find innovative solutions to housing needs. They grant flexibility by allowing states to waive compliance with certain program criteria, which govern the target population that can be served, the type of service that can be offered, the duration of service, who can provide the service, how it can be paid, etc. Essentially, 1115 waivers allow states to test new forms of service delivery. I'll mention some of the housing services that can be approved for state programs, but this is not exhaustive. Rent and utility payments for up to 6 months, housing navigation services, including filling out applications and help finding an apartment, tenancy sustaining services, from education around tenants' rights to responsibilities to landlord conflict resolution and review of lease agreements, one-time moving costs, including security deposit, first month's rent, etc., home equipment or accessibility modifications, such as mold removal or the installation of wheelchair ramps. Using the 1115 waiver, the state of Vermont created a supportive housing assistance pilot available to Medicaid enrollees age 18 and older who meet specific criteria pertaining to needs and risk factors, such as experiencing homelessness or at risk of it. A few of the services it will provide include locating and applying for housing, eviction prevention services, and help with moving expenses, including security and utility deposits. Massachusetts, Maryland, New York, and New Jersey have also had Section 1115 waivers approved to provide housing services. Other states around the country are doing the same. CMS maintains a list of all applications available on its Medicaid website. While 1115 waivers grant states flexibility, they are subject to requirements. Applications must detail comprehensive program descriptions and delivery systems, enrollment data projections, and compliance with public notice requirements. Most importantly, these experimental programs must be budget neutral for the federal government. So 3 final notes. First, 1115 waivers are meant for experimental programs, but states have the option of providing housing services using other Medicaid authorities, particularly home and community-based service authorities under Section 1915, each of which are subject to their own set of eligibility requirements. The state of Connecticut started implementing a program in 2021 called the Connecticut Housing Engagement and Supportive Services Initiative, or CHES, funded via Section 1915I of Medicaid. It's one example of funding housing services without using Section 1115 waivers, although there may be an opportunity to increase service or expand the eligible population under an 1115 waiver. Second, these programs and policies require a multidisciplinary approach, bringing together housing agencies, hospitals, behavioral health providers, social service organizations, and other community groups. States with successful programs have convened advisory boards and established have convened advisory boards and working groups in order to develop and implement programs. For example, New York established a Medicaid redesign team and supportive housing working group consisting of members from a range of housing and health organizations, along with state legislators. The Centers for Medicare and Medicaid also emphasize their role as a collaborative partner throughout the process, from program design and application review to evaluation and monitoring protocols. Applications and program design under various Medicaid authorities are ultimately controlled by the state's Medicaid agency. For state officials interested in expanding services and coverage, this agency would be an invaluable resource and place to start. Lastly, state legislators may take a variety of roles. They can help establish these advisory boards and other program goals for the development of supportive housing service programs. They can also establish timelines or deadlines during program development and help to track progress. They can appropriate funding or help to secure other resources for research and policy development, as well as funding for the benefit program itself. The Council of State Governments can also serve as a continued resource in the pursuit of developing these programs. Thank you for hearing my testimony.
Thank you so much. At this time, and with the indulgence of my colleagues, we do have 2 colleagues online who've been waiting to ask their questions. So Representative Michelle, I'll let you go first.
Thank you, Madam Chair, and thank you for this forum, this discussion, and thank you to the panelists. I've been dealing with a couple of homeless cases and speaking a lot with social workers, in particular with the Pacific Health Shelter, and they're working with a program. I think they call it H2H. So I don't know who would know about it on the panel, but I think it's a way to bypass. Like typically, if you're homeless, in order to get to housing, we don't have really direct housing, but you have to go through the pipeline. You have to go through the shelter system and the infrastructure around it, and all of that. But the social worker was explaining that in some cases, it would be more efficient to be able to do direct housing, and I think H2H is touching on that a little bit with the Pacific Health Shelter. So they're just starting a new program. Looking at other countries across the world, like Finland or Germany, other countries, Scandinavia, they consider housing as a right, and direct housing is a priority. And so I think that maybe us looking into a more hybrid system, where like in a case by case, it can be maybe confirmed that a case could be good for direct housing, and that would free up maybe space where another case would need to go through the pipeline. Any comments on this, or the idea of maybe broadening our process and enable? Of course, it depends on the stock available, but in principle, how could we get closer to direct housing rapidly?
Commissioner, do you want to take that one?
Thank you. Briefly, H2H is a DMAS program. And I think that the whole purpose of having an interagency collaboration is that we bring all these programs together and maximize our resources.
Right. And mentioning Demas brings another subject that I wanted to ask about. I've seen in some cases that I mean, we mentioned low wages for certain jobs involved with dealing with homelessness, but it's also very tough jobs. And there are, homeless cases that might be more difficult than others. We're dealing with more behavioral health issues. And my question would be, should we not bring more training, of course, increase the wages, all for that, but also bring some training with how to deal with mental health? Because I've heard many stories and spoken to many people now throughout the agencies and non-for-profits and social workers. And it's not only a very tough job, but if you don't have really training to how to deal with mental health, it could actually jeopardize the whole goal. Meaning somebody would end up maybe remaining homeless because of maybe their behavior that could be deemed unacceptable, but might not be with more training with mental health.
I can comment, from my experience as a case manager is there's an inordinate amount of training offered, which is actually very difficult for case managers to balance while they're balancing huge caseloads of folks who need service. So the Department of Mental Health and Addiction Services offers an abundant amount of training. Most agencies that I know and worked with, offer professional development opportunities to their staff on a regular basis. And so I just want to comment that we are expecting a high level of training for folks that we pay very little amounts to. So, I made the decision at some point in my life when my family was expanding, I had the opportunity to go to graduate school and change my career trajectory to be able to support my family. So I'm sure there are places where there can be more training. There always is, but I think there's a real ample amount of training offered to our frontline workers.
Okay.
Can I add a little bit? I mean, that is a big issue of what I heard from our shelter providers is that they don't have the capacity to deal with clients when they have this high level of care. So what we're trying to do is to look at the resources, because no matter how many training you provide, if they're not in the field of providing mental health services or addiction, they're not going to be able to be successful. I had a conversation yesterday with the community health centers where they actually are providing also housing to some of the mental health patients. And I said, wow, you guys are providing housing, and I'm trying to get you guys to come into the space of the shelters. That is a huge issue that we need to bring together the healthcare system to be able to help our shelters and our service providers.
Well, thank you, Commissioner. I'm glad to hear you continue emphasizing on the interagency work and all stakeholders. It's really important that we achieve that. Thank you very much, Madam Chair.
Thank you. Representative Johnson.
Thank you so much, Madam Chair, for putting this together. This is a very serious issue in my district. I have 3 homeless shelters, a population of 25,000 people here in Eastern Connecticut. And they are overflowing. The state really hasn't been very good at helping us out with that. The shelters have been purchased by people in the area to try and make sure we have a place for homeless people to stay. So we have the Holy Family Shelter, we have 2 no-free shelters now, and we have the domestic violence shelter here in town. We also have more public housing on a per capita basis than anywhere else except Hartford. And so I just wanted to kind of set the stage a teeny bit to kind of affirm what was spoken about with respect to the mayors and the forum panel, and that is we provide for the region. We take care of the region, whether it's nonprofits, whether it's homeless shelters, and we can't do it alone, and we can't do it without help. And so a couple of things. One of the things that I'm glad to see our Eastern Connecticut regional person Joseph Shabat's talking about chess, because chess is a program Connecticut has been utilizing through the Medicaid program. And we are in that situation where we're looking at expanding it. We have it on our agenda to have some language drafted to look at chess, but we've been doing it, I think, for the past 5 years, but only in certain areas. And right now the state is taking applications for chess, which keeps people in their homes, or if they have it started out with, if they had a cost through the Medicaid program of more than $40,000 a year, then they would be eligible for chess so that they could get housed, and they would be able to limit the cost of Medicaid services in that circumstance. I think we're expanding it now. I hope we expand it. The other thing is we have had a very poor social safety net. Last year, we finally increased TANF from 21 months for a lifetime to 36 months, and we increased the benefit levels and got rid of some of the benefit cliffs. The horrible social safety net programs that we have had here since the 90s is something that we've been working on to address. And one other aspect of that, and may I say, before these very poor social safety nets programs were put into place in the 90s, we had good, robust social safety nets, and we didn't have people that were homeless to the extent that we do today. Nowhere near. It was not, I didn't go down to the riverbank and see tents lined all along there, which I have now in my riverbank, even in the winter. Which gets to the other thing where my no-freeze shelter cannot house the seriously mentally ill people. They don't have the capacity to do that, and they have people living in very close quarters. So people that have severe psychiatric disabilities try and find a place and get warm in the waiting room, the emergency room. They're living again on the riverbank. They're doing things that will probably end up ending their lives. And so this brings me to a solution in part. We had a meeting on the Complex Care Subcommittee of the Medical Assistance Policy Oversight Council yesterday. And we talked about how can we deal with the people who are being refused in nursing homes because of their behavioral health diagnosis. So we have that going on, and they don't want to have their designation changed as a nursing facility and then not receive Medicaid reimbursement because they have too many people with mental health problems. Plus, they have a tendency not to feel that they have the staffing availability for people in that circumstance. But one thing that came out of the conversation, which I thought was very interesting, and it might be something that we can work on to combine our housing and our Medicaid programs, and that is the fact that rest homes or housing programs that would be rest homes, they would be able to take people with behavioral health issues and have a mixed population of seniors, people with disabilities, people with behavioral health, and not worry about whether or not they're going to lose their certification. And if we expanded rest homes and gave them the support, apparently they get more reimbursement. We'll have to look into that this session for their care. We would mitigate some of the problems that we're facing now with older people who have illnesses, go to, a hospital, and then come out, and because they are in too long, they're in the hospital nursing facility too long, they lose their apartment, and then they don't have any place to receive home care services, but they don't meet the standard for skilled nursing facility level of care. So they're out in a shelter, or if they're mentally ill, they have the problem of getting placed anywhere because no one can take them. So I have a number of people in my district in that circumstance. I've been meeting with the people who run the homeless shelters on these issues, and I've been meeting, trying to figure out what it is that's going on with the denials of coverage for people trying to get into nursing homes, which they didn't have these problems about 25 years ago. And apparently we learned from the meeting yesterday that this is due to a Supreme Court case called the Olmstead case. And we'll take a look at that to see what it is about the Olmstead case that has made it pretty hard for people with behavioral health problems to get admitted to a skilled nursing facility. Part of it, as was mentioned by our nursing home ombudsman, was I'm sorry?
If you could, if there's a question in there, if we could get to that. Unfortunately, we're really behind on time. So if you have a question, if you wouldn't mind getting to that, I know the commissioner has other places she's got to be as well. Thank you.
Sure. Well, have you looked into the rest home issue and whether or not we can add more housing through doing more rest home certifications and doing more outreach in regard to that issue?
Looking forward, continue that conversation.
Okay. Also, I just one more thing to add, and that would be we should take a look at what we used to have, and that is we used to have a social safety net, state-assisted general assistance, where people were able to go to the town and get the money that they needed to keep themselves housed, keep the heat on and the lights on, and so that would be another suggestion that I would have for the municipalities to try and stop the homeless population from growing. Thank you. Thank you, Madam Chair.
Thank you, Representative Johnson. Representative Gilchrist.
Great. Thank you. Thank you both. To you, Ms. Ross, the conversation on vouchers, now I'm going to kind of jump all around, but want to also thank CSG for being here and speaking on the 1115 waivers. As I mentioned at the start, we had a working group over the summer and fall about social determinants of health and the potential of using 1115 waivers. And what came up with regards to the CHESS program that folks have spoken about is one of the barriers folks have experienced in having that program be effective is that there's no vouchers. And that was the main crux of that, was my understanding. So as we think through, could we use the 1115 waivers? It'd be helpful to know when you're saying there's not enough, could you just talk us through what's the top amount someone could get for a rental voucher? How many people currently can get them versus how many need them? And then do the vouchers help with the deposit? Because that was a piece that maybe the 1115 waiver could help with, because I'm hearing most apartments are asking for the first and last month. And if the voucher doesn't cover that, I would think that would be a huge barrier.
I can answer those, and I'm sure the commissioner can probably add to my answer. So the first was how much can a voucher pay for, which varies widely depending on the area of the state, the size of the family, et cetera. So there's a table for the state rental assistance program, which is state funds and the department administers, which has different rent levels depending on where the unit is located, the home is located, and the size of the family. All of those are on the department's website. And then there's a table for the federal Section 8 program, which is the federally funded housing voucher program, which has those rent limits as well. I think in the economic impact panel, possibly Aaron Boggs can talk about the sort of level of vouchers and how they do and do not meet the rent levels. Your second question, I think, was how many people currently access. So roughly, and the commissioner will correct me if I'm wrong, the rental assistance program, state funded rental assistance program, serves approximately 6,700 families. And that's inclusive of the CHESS program that you mentioned. So that uses state-funded rental assistance program to pair with the CHESS services. And how many people need rental assistance? Well, I said 119,000 families pay more than half of their income on rental costs. So all of those families would benefit from some level of support in affording their housing costs, especially when we talk about prevention. And I missed your fourth question. I tried to write them down quickly.
Does it at all cover the deposit?
Oh, there's separate programs. I'll defer to the Commissioner's Security Deposit Guarantee Program and other things that the department funds.
Thank you. This actually in the resources that we provided to the CAN system, we also provided $5 million for security deposit, 2 months.
Thank you. Thank you very much. Representative Dathan, please.
Thank you very much, and I appreciate the commissioner being here today. I would love to know if we have a sort of analyses of geographical locations of where we have unused vouchers, and if we can get an understanding on why vouchers are not being utilized on a region by region basis, so we can understand, because I don't think it's a one size fits all for our state. And I think we need to think about those reasoning. I mean, we do absolutely have a housing shortage, and it's a huge economic problem that we're having in our state, and it needs to be addressed. So I would love to figure out how we can address that. My second question is more of a comment to Joseph. Thank you so much for coming today. It really has been helpful. If you have any sort of report that you all have done to analyze how we can best fit these waivers in, I know the working group on the social determinant of health, led by Representative Jillian Gilchrist, has been outstanding, but I really want to make sure, as part of the Human Services Committee, that we can kind of look at the sort of details and maybe best utilize federal dollars to address this major problem we have in our state. So that's all for today, but thank you so much for your presentations.
Thank you so much. And seeing no other questions at this time, I'd like to thank the Human Impact Panel. And thank you for your time, especially today, and the other members that are not still here. And we'll move on to our Economic Impact Panel, please. Pete Myers, Aaron Boggs, Carl Lance, and Derek Koval, please. Morning again. Thank you for being here. Up first, we have Pete Myers, our policy analyst from CBIA, to speak about what CBIA is seeing with all of this.
Yes, of course. Thank you so much for having me. It's a pleasure to be here alongside all these great advocates for the housing industry. So I'm Pete Myers from CBIA. I have the honor of covering the Housing and Planning and Development Committee, as well as several other committees for CBIA. And I just want to touch about something that we hear literally every single day from employers in Connecticut, and that is a struggle to find employees. Connecticut has over 90,000 jobs currently open. And one of the things we hear about, a reason why they're struggling to find employees, is the cost of living and the cost of housing in that area. And I just want to highlight one thing that CBIA has been doing over the past few months, which is conducting economic competitiveness forums literally all over the state. And actually, our CEO and vice president are conducting one right now in the city of Stamford. And these forums are really focused on talking to employers about what issues they're facing, what issues their employees are facing, and how can they improve in Connecticut. And I want to touch on one that spoke to me and really hit me as a young resident in Connecticut. And that was in the city of, in the beautiful town of Sterling, Connecticut, in Eastern Connecticut, where this employer in the manufacturing space was really growing at a fast pace. And they were really struggling to find employees. And these are good paying jobs, making $80,000 to $100,000 a year. And their employees were saying that they are driving an hour, hour and a half to work every day, just because there are no housing options in their price range in the area. So that really spoke to a lot of our staff who are young first-time home buyers. I actually just bought my first house a few months ago. So we really looked at what are ways we can make home ownership more affordable in Connecticut. And we're really excited this year to be pushing a couple of proposals. One, to create a first-time home buying savings account in Connecticut, similar to what Iowa has done. It's been very successful there, but we would like to increase the utilization. So it's really allowing employers to contribute to this and employees to contribute and receive tax deductions for doing so. Something to really help bring down the cost right away. And I know Representative Hughes had a great question about what are we seeing right now? What can we do right now? I know it takes a while to build housing. We all know that. And our workforce shortage is a right now situation. So these are solutions that are right now. If you can contribute to this, receive tax deductions for it, that's a right now fix to help address the high cost of housing. Another one, I actually just submitted testimony on it last night in the Planning and Development Committee. It's focused around allowing towns to abate $500 a year for certain first-time home buyers off their property taxes for 5 years. So it ends up being $2,500. And we've heard back from a couple of times, well, it's not a lot of money. But to a first-time home buyer, as one myself, $500 goes a long way when you're first starting out. And we think those are a couple of areas that we can introduce right now to help handle that issue. And in closing, as I'll keep it brief, our CEO, Christy Pentima, spoke to the Affordable Housing Roundtable over the summer. And he highlighted something that I just want to highlight here. CBIA supports all types of housing, whether it's home ownership, middle income, low income, whatever type of housing it is. Connecticut needs it all to be able to fill these 90,000 job openings. So we look forward to working with these great advocates and as well as our municipalities on how we can create more housing in Connecticut and help make the current housing stock a little bit more affordable for first-time home buyers. Thank you.
Thank you so much. Up next, Erin Boggs, the Executive Director of the Open Communities Alliance. Thank you.
Thank you for hosting this session on this very important issue. I am Erin Boggs. I'm Executive Director of Open Communities Alliance, which also coordinates Rowing Together Connecticut, a consortium of organizations dedicated to dismantling the barriers to affordable housing all across the state and promoting equitable investments and policies to support residents in lower income communities. I'm here today to talk about the economic cost of zoning restrictions. And I'm not going to read my entire testimony that I wrote. I'm going to try to make it quick and hit the high points. You know, there are experts all around the country who've talked about zoning, and they all say that Connecticut, no matter what side of the aisle they're on, they say Connecticut has some of the most restrictive zoning in the country. The Bipartisan Policy Center found that restrictive zoning and land use regulations lead to a 24% increase in the cost of single-family homes and a 40% increase in the cost of multifamily homes. So we're really holding ourselves back economically by having stringent regulations on our zoning. And this is a particular problem, as we were talking about with regard to workers. And, you know, by our estimates, we're actually missing closer to 135,000 units of affordable housing. And that we can draw a straight line between that and the unfilled jobs we have in the state. If we did housing right, there would not only be the benefit to the people who are looking for housing and the businesses that need to fill jobs, but Connecticut could realize about $47 billion in additional income for residents, translating into about $9.6 billion in additional state and local tax revenue. So it could be a big boost to the state's economy. We also know that part of the picture here is about the history of segregation. We know that the key foundational U.S. Supreme Court on zoning, Euclid versus Ambler in 1926, was built on a district court case that found the blighting of property values and the congesting of populations whenever the colored or certain foreign races invade a residential section is so well known as to be within the judicial cognizance, meaning we don't need evidence on that. Policies and approaches like that and things like redlining and racial covenants have led to a situation where we have lots of Black and Latino families who have disproportionately lower incomes and wealth than white families. And in fact, Richard Rothstein, the author of The Color of Law, estimates that the enormous wealth gap between Blacks and whites, with Blacks having about 10% or less of the wealth as their white counterparts, can be attributed almost entirely to the denial of wealth building opportunities resulting from redlining. So, you know, we talk about race and, you know, I think there's lots of questions about why we need to have, what's the connection to affordable housing? But part of it is that there's like this history and where we've all landed in the aftermath of it. And we need to think about how we do this equitably and also consider the fact that Black and Latino families and families of color are a growing part of our workforce. They're already a critical part and a growing part. And for the sort of future of Connecticut, ensuring that all of our kids have access to resources, both if they are in cities and maybe parts of cities now that are underinvested, but also would like choices elsewhere, is really important. To that point, we have done work with families with vouchers to find out what they want in terms of where to live. There's some questions out there right now about choice versus denial of opportunity. And what we've learned is pretty helpful in a sense to all of the things we need to do. About half of the families of vouchers we have surveyed and interviewed very much want to stay in their longtime communities that are higher poverty and need investment. The other half very much want choices. So like, I think that should put to rest some of the questions about what's going on. We have a history, we have choices that some people would very much like. I think, what do we do about this? I think the first thing to remember is that land use is really about a lot of different priorities. We really want to align a community with community visions. We really want to protect the environment. We really want to support the state's overall need for housing. And fortunately, the Connecticut legislature, in its wisdom, understood the need to balance some of these seemingly competing priorities and set up the rules for delegating zoning, which is a state power, to towns with all of those things in mind. So we know that the Zoning Enabling Act says that municipalities need to encourage the development of multifamily dwellings to meet the regional affordable housing need and promote housing choice and economic diversity, including housing for both low and moderate income households. That's just the law that applies to zoning as towns are supposed to be implementing it. I think the second important thing to know is that denser housing, like multifamily housing, like condos, is more affordable. And so if we aren't zoning for that, it's going to be really hard to meet our housing needs in the state. And it's why it's concerning that 50% of the state's multifamily units are located in roughly 5% of the land area of the state. I think solutions really focus on getting some clarity around what the Zoning Enabling Act means there, what is expected of towns, and that's something the legislature is fully in its purview to weigh in on. And then we also need to think about things like investing in infrastructure, like sewer infrastructure, to allow towns to carry out the vision that they have in a way that is perhaps denser and better for walkability, the environment, and other concerns like that. So thank you for the opportunity today.
Thank you so much. And I think that dovetails nicely into our next speaker, Carl Lance, who is the president of the Connecticut Realtors, to talk a little bit about the market and perhaps where people are building or not. Thanks.
Good morning. Thank you for having me. My name is Carl Lance. I'm president for Connecticut Realtors and a sales agent with Coldwell Banker in West Hartford. I don't know how many people in this room, aside from my neighbor right here, have bought or sold a house in the last 4 years. But if you have, especially on the buy side, you probably have lost a few opportunities to buy a house. I looked just before I sat, how many times?
Well, my first house fell down. It's a long story.
Oh, I was talking just about offers. Did you make more than one offer?
No.
You're the miracle.
You're lucky there.
Most people have experienced the problem of being able to even purchase a house when they're looking. Even if you have the ability to purchase a house and have the affordability, there is such a low inventory that many of the houses have multiple offers when you go to buy them. I just looked before I came over to the table, and there was 2,975 houses in the entire state. That is single family unit and condo for the whole state. That is historically low. And we've sort of been pushed into the perfect storm of housing through the COVID market, where people got artificially low rates and now are disincentivized to sell their home. Rates today, I think, were hovering right around 7%. I'm sure many of the people who bought in the last several years are having rates on their mortgages like mine at 2 3/4. So even if I wanted to sell to have a bigger or a smaller home, I'm disincentivized because buying that bigger or smaller home, the price on that house has gone up significantly, and the cost of ownership has gone up significantly because of those mortgage rates. That's something I don't think we can build our way out of. Building new homes takes a significant amount of time, and we need to incentivize sellers to find a way to make it so that they want to sell. Because I think there is a significant number of people out there who would want to sell their house. Maybe people who would like to downsize or upsize or just change, maybe they want to move to the beach, whatever it might be. They may want to sell, and they are having that disincentivization because of their rates, because of the cost. We at Connecticut Realtors and all of the realtors in the state espouse the values of fair housing and really want to see the dream of homeownership for everyone. So again, programs that help people to get into homes that they own. The chance of becoming homeless, as we're sitting here saying, is like 1 in 200 less if you own your home than if you're a renter. So those are things that we can also do to help people. Those people who have that ability to step up and own their own property, that would be another thing that would help to solidify, because your costs remain well, they don't always remain the same. Taxes, insurance always goes up, but your mortgage hopefully stays the same through the time you're there. That's something that keeps your costs the same. That also sort of leads into the ability of people to rent. Rents have gone up because of these price increases and lack of inventory. If you see all of the kind of mom and pop multifamily properties that have sold, the prices on those have gone significantly higher because of that lack of inventory, which then the new owners have to charge a higher rent in order to make ends meet as a landlord. All of these problems are sort of coalescing, and as I said, the perfect storm. And I think the biggest issue is not just everybody says they need homeless housing, they need affordable housing. Until we have enough housing for everyone, all of those things are going to be coinciding. So we'd like to see more housing in the state of Connecticut. Thank you.
Thank you so much. And to that end, our next speaker is working on housing in Connecticut, Derek Koval of Beacon Communities.
Good morning. Thank you, Madam Chair and committee members. Dara Kovel. I'm the CEO of Beacon Communities. We are a mission-driven organization that builds, owns, and manages affordable housing. We are active in 12 states in the Northeast and Mid-Atlantic, including here in Connecticut, very active. I'm proud to call myself a Connecticut resident from New Haven. We are actively developing right now housing throughout our footprint, but in 7 states, including Connecticut, Massachusetts, New York, Ohio, Maryland, Virginia, and DC. So we've had the pleasure in this time of getting to experience construction costs, interest rates, inflation, insurance costs, overall challenges within the marketplace of producing housing. But I have some really wonderful success stories to tell, and I'd like to share some of those here with you. I'm also feeling a little schizophrenic today because having just sat through the homelessness panel, I would love to spend some time talking about those issues. We are currently building permanent supportive housing in New Haven, in Boston, in Albany, in Pittsburgh, and in Baltimore, housing that is housing people who are currently living on the streets. And frankly, in our 20,000 units that we own in our footprint, while many of those units are for housing people who may have other housing choices, thousands of those units are housing people who would not otherwise have a place to live. And those are supported, whether that's through permanent supportive housing or Section 8 vouchers or other things. We do a lot of partnerships with housing authorities across our footprint. And that type of housing, if it weren't there, would certainly result in greater levels of homelessness. So the tools that make a difference in this work, you've already heard from the previous panel, as well as this group, is our resources. I think one of the things that I get asked a lot is, why do you need subsidy to build affordable housing? Like, why does the state need to write a check in order to make this happen? So if the market could provide this housing, it would be providing this housing. We build a quality of product that I think in many cases outdoes even market rate housing. And that's partly because we're doing other great things with it. We're creating quality homes that are going to last for 30, 40, 50 years. We're a leading edge sustainability developer. So we build housing that is electrified and is going to be able to, result in non-fossil fuel dependent housing. And all of these things cost money, but they are investments that we believe are worth making. And we have great partners here in Connecticut who support that. And then the other kind of 2 major factors are really an agile and streamlined delivery system for financing affordable housing. And I just want to do a shout out here to Commissioner Salem Mascara-Bruno, who is very determined to see housing delivered. And anytime I see her, she's asking when our next closing will be. So she's been really pushing and promoting housing and utilizing the resources that the legislature has dedicated with Governor Lamont to make sure that we're producing as much as we can here. And then, as you heard from Aaron and others, zoning is a huge predictor of our success in creation of more housing. So the 2 main takeaways I want to make sure you get from this piece is that housing is economic development, both its creation and by producing more housing, both in the construction of it and having it in communities all across the state will be healthier. And then housing production at scale is frankly the solution to the homelessness crisis, as well as all the other challenges that we face attracting employers and other aspects of what we want to see here in a vibrant Connecticut. So just a couple of examples of work we're doing right now that I think if we could do more of, we would really love to, and we would be very motivated to do that. We have a 200,000 square foot adaptive reuse of a factory up in Windsor Locks called Montgomery Mill that we turned into 160 units of housing. Half of those are market rate, so high-end market rate units, 80 of those units, and then the other 80 units serve people from 80% of area median income all the way down to literally people making nothing and who have Section 8 vouchers. And so we have this incredibly diverse community in Windsor Locks. It is a transit-oriented development. It was a brownfield remediation. We created new access to a park there. There's all sorts of amazing stories, but the two most amazing things about that property is we attracted 12 people from 12 different states came to move into that property when we opened it. And that just speaks to the ability of housing to attract new workers, new people. We have everyone from cocktail waitresses and Uber drivers to insurance executives and pilots living in that building. And that when you create that kind of vibrant community, we're attracting the talent we need. We have the employers are happy. It's near, obviously, a huge amount of transit. And I like to think when we started that project, the construction of the train station in Windsor Locks was supposed to be done by the time we started. And I think they just got started on the construction about 6 months ago. So we've actually incentivized TOD in the reverse order. But we've also seen several, almost half a dozen new businesses open up and new development happening around that. And without that investment, it never would have happened. So that's a really exciting thing. And the economic, what that property throws off in terms of the new residents who live in it and the money they spend and the taxes they pay is $3 million a year in economic development impact. So that if we can create that, and those are active members of the Connecticut, citizenry, and they're spending money, they're working, they're paying taxes, and it's just a phenomenal impact. It also will, obviously, we took a property that was not on the rent roll, on the property tax rolls, and over time that will pay hundreds of thousands of dollars to the town of Windsor Locks. So that's just a great, exciting story. Another story I'd like to share is down in New Haven. We're the owners of Ninth Square, the residences at Ninth Square, which is 330 units. It was actually developed back in the 90s. And we have not only sort of revitalized the existing housing with a mixed income community, again, half affordable, half market rate, but we've taken the ground floor retail and taken 50,000 square feet of retail and now have 21 businesses who are operating there in New Haven, a brand new, vibrant kind of neighborhood in some ways. Of those 21 businesses, 60% are entrepreneurs of color, and more of half of those are doing their business for the first time. So we've created a whole sort of incubation that is connected to the health and vibrancy of the housing kind of ecosystem that we're creating there. And right around the corner, we're getting ready, to start construction on a 76 unit housing development at State and Chapel in New Haven, which is actually taking office space that has been vacant since even before the pandemic, but vacant since the pandemic, converting it into housing and creating new construction to create 76 units of housing. And in that case, we're also partnering with Columbus House to create permanent supportive housing in 16 of those units. So we'll have 16 households in downtown New Haven across from the State Street train station who will have access to services, both sort of services for their own case management needs, but also services within the New Haven area. And it will have a huge impact, and we'll have people who earn 60% of area median and market rate housing there as well. So, and some ground floor commercial. So I could sort of go on and on about the things we can do here, but I think the bottom line is if we can produce more housing, the question was raised earlier, if we can produce more housing, we can do it more quickly and really get to scale. We can really change the dynamics. And as was said earlier, it has to be at every level. There are sorts of tools that we can use on the resource side. I'd love to talk about the state creating a housing tax credit. Our friends to the north in Massachusetts and in New York, there's a state housing tax credit that actually helps to support housing, kind of expands the work and the tools that can be done. tax abatements, property tax abatements are a very powerful tool. And in the representatives, the chair's hometown of Avon, we we got a tax abatement there that is going to be allowing us to build 176 units in Avon, and we're very excited to have that there, Senator, as well. Hoping that happens this year. But that's a very powerful thing. And then housing subsidies, as was talked about earlier, the impact of having rental subsidies for people who are much lower income can both obviously help the resident, but can also help generate more housing units. And then we have to continue to strengthen zoning incentives, asking towns to think about, plan for what they need in their communities really does make a difference. And we saw that we had a great collaborative experience in Avon where the 830G process actually led to an engagement and a great design outcome. So thank you so much for your time. Happy to answer any questions. I'm very appreciative of you taking the time to talk about these important issues.
Thank you. And as we did before, we will have questions from colleagues. I would ask, please limit your commentary and one question each if we could, because we are almost out of time and we do still have 3 more speakers. So anyone on this side? Representative Paletta, please.
Thank you. Thank you, Madam Chair, and good morning still to 4 of you. Thank you. I just briefly want to make a comment about home ownership. I think home ownership is so important. It really is part of the American dream. I mean, to what we were saying, there's so many folks out there that is their biggest assets, their home. It's so important. It gives you kind of stake in your community. You're going to kind of dig your heels in and you're there. You might get involved on a board or commission. And I know it's been said over and over, but it's something that personally, sitting on the housing committee, I've really wanted to see more people come in. But what we hear is the opposite. We hear people come in and say, I can't afford to buy a home in Connecticut. I can't make it here. I can't afford to live here. I can't pay rent here because the rent is too high. We heard that before. So one of the ways I think, and it's just kind of obvious economics, is the way that we get the price down is to increase the stock. And I still haven't heard, in my time on the housing committee, a really good way to increase the stock, except that we need to build more, but we just haven't heard how do we get there. There's a lot of legislators that say, not in my town. There's a lot of legislators that say it should go through the proper, channels, zoning boards, as you mentioned. And I support that. I really do believe in local control. But the only way to really lower the cost of living is with more competition. And I'm all ears to listen to that. But when there's, for instance, in the town of Watertown, 3 homes on the market, okay, you're a realtor, that 3 homes on the market and there's a bidding war. You can't tell me that the person that's buying that home is not going to be outbid by the next person over. And it's a vicious cycle until someone says, okay, it's too much and I'm going to pay for it. And that's why people are overpaying for homes. My question to you, sir, from the Connecticut business and industry, you talked about businesses, and I think there's got to be something that dovetails between businesses and their employees. Is there something that a business can do to incentivize their employee to buy a home here, to work here, to live here? Is there something that a business can do to help their employees or encourage them, maybe through an incentive, through something to get them into a home, and then maybe they'll stick around, stay in Connecticut, live, work, and raise a family? Or is there anything?
Yes, thank you very much for the question. Yeah. And I would say, reference to my first proposal that we have, is the first time home buyer savings account. States, I believe 13 other states have this. A state like Iowa has seen a lot of success with it. Just the utilization has been down. So what we are proposing is allow employers to be able to contribute to these accounts as well, and really give the employer a chance to put some skin in the game as a recruitment piece. So this would be a first of its kind, at least in the region. Massachusetts, New York do not have an account like this where employers could contribute. So it would give us a competitive edge over our neighboring states to recruit employees here. And I should have mentioned earlier, we have some of the best trade schools, some of the best colleges, some of the best universities in the country in Connecticut. Making sure we can keep those residents here. And this could be a tool that a large employer or a small employer could use to recruit an employee coming or a student coming right out of trade school and say, hey, we're going to contribute $3,000 a year into this first time home buyer savings account for you, to really give them the ability to compete in those bidding wars. And look, they might not be able to buy that $1 million home right out of the gate, but to be able to get into the door, this could be a little bit of help that an employer could offer. And in turn, it helps them recruit an employee and let them buy a house here. The employer is contributing. They're happy you're here. They invest here.
Right. And I'll just end by saying, I know we're trying to be brief. I'll just end by saying you certainly have more stake, not only in your community, but in your job if you own a home close by or, in the general region of where you work. So, if you're able to buy a home, you're probably going to stay with that company or stay in that profession in this area, in this state for a long time, as opposed to if you rent, you're more likely to say, oh, I got a job offer in, Texas or somewhere else, and you're out. You pack up your things when your lease is out and you're out. If you own a home, you're probably going to stay here. So I think it's a good idea, but I'm willing to listen to ways in which we can, increase housing as well to bring costs down. But I think if we can get people into home ownership and live here and work here, I think it could be a good thing for the state of Connecticut. Thank you, Madam Chair.
Thank you. Representative Chafee.
Thank you, Madam Chair. I'd like to just start off by thanking all the panelists today. It's a very informative discussion. I'll be brief because I need to run to another meeting. I know that when we're talking about homelessness and what the root causes are, I think time and time again, I've heard high rent, low inventory, high prices, barriers to home ownership. I've read articles mainly focused on other parts of the country, being the Sun Belt or out west, about private equity firms buying up single family homes and also short-term rentals taking homes off the market and obviously seeking to rent them out for vacations and things like that. Would anyone here have any data? How much of an impact is this having on Connecticut's housing market?
I don't have any specific data, but I can anecdotally speak to it in the sense that that is not a giant problem in Connecticut. We do hear of it in certain communities, more so with the short-term rentals being in vacation areas, shoreline, or areas where people would want to go for the weekend. And I have not heard significantly about institutional investors buying significant numbers of houses in Connecticut. I think that is definitely a problem in other areas of the country, and something to be looked at and to have an eye on. And we certainly have our eye on that. And we'd love to see any programs also that incentivize owner occupant buyers, possibly tax abatements to sellers for selling to someone who will live in the house as opposed to using it as a rental property. Those kind of things would be great for all of you out there that are searching for houses and getting outbid by, if there are institutional investors, those folks.
Okay, thanks. I think we may have a couple more questions online, but I do want to have our last three speakers come up. So if you wouldn't mind vacating the chairs for them, that would be great. Karen Du Bois Walton of Elm City Communities, Greg Kirschner, and Pete Harrison, please. We are at the noon hour, so I'm trying to be mindful of what time we have left here and to catch as many folks as we can. Karen Du Bois Walton comes to us as president of Elm City Communities and the Housing Authority of the City of New Haven. Go ahead when you're ready.
Good afternoon. Thank you so much for this opportunity and thank you for this conversation. I am Karen Du Bois Walton. I am the president of Elm City Communities, which includes the Housing Authority for the City of New Haven and also the Glendower Group, which is our development entity. At Elm City Communities, we serve about 6,000 families. And importantly, there are about 30,000 families on our wait list. When you consider that about 400 families leave our program annually, you can get a sense that it will take quite some time to reach a family who is 30,000 on a list. It's also important to note that while many of those families originate from New Haven, about a third of our wait list is generating from communities outside of New Haven. And I highlight that just to continue to bring home the fact that this is truly a statewide concern about the need for housing that's affordable in our communities. It's typically about a 7-year wait to move through our wait list. And all of those are the reasons that we moved head on into housing development and into advocacy type work like being in front of you today to talk about these issues. Housing unaffordability is very much, and homelessness is very much an issue of the lack of production of housing. And that lack of production dates back many years now. But housing production never recovered past the recession of 2008. We have been underproducing housing units for a long time. And as we know from even basic economics class, supply and demand, when you have lots of folks who need something and there are limited amounts of that, the cost of that item soars. And that is what we're experiencing right now. In New Haven, over 50% of families are cost burdened, meaning they're paying far more than they can afford for rent. And when you look at the lowest income families, that skyrockets to about 85% of our extremely low income families are paying more than they can afford for their rental costs. And we believe that just to begin to even stabilize rents in New Haven, we're likely looking at the need for about 8,500 more homes in the city of New Haven. This shortage, this underproduction is driving homelessness. It is also forcing families into really untenable situations. They're making difficult economic choices. They are often ending in sub-quality homes in places that you or I would not want to see families needing to choose to live. In fact, when we look at our housing choice voucher population and look at the units that they are selecting to move into, about 40% of those units will fail the inspection when we send folks out. It just speaks to the fact that people don't have great choices in a really tight rental market like this. And we need to be doing a number of things to improve the quality of housing options that are out there and to build many more options. So quickly, just where do I think we should be going? One, I think we have to really recognize the fact that for so many reasons that are very much connected to a decades-long history of underinvestment in our cities that's related to redlining and other things, we need to do some really specific investments and reinvestments in our cities to make up for what's happened in those times and to rebuild quality housing abilities, but also to invest in the other things that those communities need. It's the work that we've been doing with production of housing in the city of New Haven, where we are now the largest developer of housing that's affordable in our community, having brought back thousands of new units into the market and still with many more in our pipeline, including new opportunities. It's also why we are strongly advocating for a bill this session. That's the Housing Growth Fund bill, which will drive resource back into the communities that are building housing. And that's not just the cities. There are many communities, some communities that you all represent up here that are building housing that would benefit from a housing growth fund. We believe as a state, we need to grow. We need to grow by building housing. And so we ought to incentivize that by putting our some financial incentives to that. So we are hoping to move forward this session, our bill on housing, on the Housing Growth Fund. We also need to then unlock the potential to build more housing. We do that through things like helping the folks who want to do quality development to be able to develop throughout our state. We believe that as a nonprofit developer like we are at Elm City Communities, we ought to have the ability to develop in communities where housing is needed and desired. And that's why we support the Housing Authority expanded jurisdiction bill that would allow that. And then we need to certainly end exclusionary zoning and really incentivize our transit-oriented development. We need to be supportive of the bills that are seeking to rezone communities that have blocked the development of housing. And you'll hear, I'm sure, more about that from Pete as well on transit-oriented development. But it's why we're standing in support of bills like the Work, Live, Ride bill as well. And then finally, we need to protect families and protect our renters. And you heard a lot about that in the first set of panels. We need to be making the significant investments in our homelessness system. And I won't go deep into that because you heard so much about that already this morning. We need to make the investments in housing subsidy. We need to increase our dollars going into RAP. And we need to ensure that the way that our vouchers have been mentioned by representatives, ensure that our vouchers can be used by aligning what the voucher can pay for with what it costs to house families in a particular community. It is not one size fits all, but that's the beauty of the way that you could set payment standards is you could make it work. You could make the voucher work in each community. And then finally, we need to make sure that we're protecting families from eviction while we go through this very tight time in our market and while we're building the housing we need to build. So I thank you for the opportunity to be in front of you this afternoon and certainly open to questions after my colleagues.
Thank you so much. Up next, we have Greg Kirschner, the Executive Director of Connecticut Fair Housing.
Hi, thank you very much. I will try to be brief. I would reinforce many things that were shared just now and earlier by Erin Boggs from the Open Communities Alliance. The point that I'd like to reinforce is that Our segregated living patterns were created by a long history of intentional acts by the government, by private actors. While many of those are now illegal, the one tool that remains to perpetuate segregation to a large extent is zoning. Some scholars have described zoning as being the amber that has locked communities into place. But ultimately, zoning is not a rule or force of nature. It is a choice. Segregation is also a choice. And that choice is made every day across the state and local zoning boards, and it's made every session of this legislature. So we really need to start making different choices if we want to see anything change. Just some brief comments on how zoning and segregation interact. It has been recognized in social science that affordable housing, public housing, are associated with negative stereotypes about households of color. The Second Circuit Court of Appeals has explained that opponents of integration have learned to mask their intentions, and they use language to object to affordable housing, such as invoking change in character, expressing concern about overcrowding of apartments or overrunning of their schools, or by drawing negative comparisons to more urban areas where people of color tend to live. That is sufficient to demonstrate discriminatory intent. Earlier, there was some mention about how to this day, because of segregation, Black households tend to live in about 5% of the land area in Connecticut, largely concentrated in urban areas. They also tend to wind up renting in those areas, and they are faced with extractive, exploitive conditions. As mentioned, there are many out-of-state, I believe the mayor of Hartford mentioned, many out-of-state operators who purchase these properties and seek to extract as much as they can from the community and invest as little as they can. Tenants are left with few tools to fight this. They can be evicted if they complain about their housing conditions. They face all the instability and costs of losing their homes and having their rental records tainted. So what are some of the solutions that we recommend? One, protect tenants. Allow tenants who pay their rent to stay. No one who pays their rent and complies with their lease should lose their home just because their lease is up. Second, we need to look more closely at zoning. The state needs to either create conditions where the market can meet the need, or it needs to step in itself and create the housing that the people of Connecticut need and deserve. Thank you very much.
Thank you. And finally, Pete Harrison, who is the director at Desegregate Connecticut.
Thank you, Madam Chairman. Thank you, thank you, other members that are still sticking around with this. My name is Pete Harrison, and I'm the director of Desegregate Connecticut. We're a program of the Regional Plant Association, and we're a pro-homes coalition of just about 80 different neighborhood and nonprofit groups. We are dedicated to seeing Connecticut be more prosperous, more equitable, and more sustainable through the lens of land use reform. Others have talked already kind of about the legacy of zoning, and Greg and Karen have both said this. Aaron has said this on this panel, so I'm going to skip that. But we try to talk about this story in 3 acts. Act 1 is very much about the active, all levels of government and private sector discriminatory policies. We have seen that across the board at the federal level, at the local level. And the only thing I want to add to that is really starting after the Fair Housing Act of 1960 at the federal level, we saw great downzoning across the country, frankly, but specifically in Connecticut. One example of this, Greenwich has probably been about the same population for 50 years, although its pattern of development has sprawled out from the center urban core historically. That's just one example. So we know that there was active choices about this type of discrimination. The second act of that is what that's doing today to our economy and to our society. We've talked a lot about the cost burden for families, the lack of workers for jobs. All of that is really because of these exclusionary zoning policies that have been enacted over decades. That's things like single family housing on large lots, which is 91% of residential land in Connecticut. That's allowed as of right. Only 2% of residential land allows multifamily housing as of right. So we have a massive mismatch between what we are allowing to be building over the previous decades. We are also not building, as Karen has mentioned, and others. We usually rank around 49th or 50th in terms of permits per year annually. That's been going back to the Great Recession. Further back, really our peak of building was in the 1980s. We're at about a quarter of permits even back to that period. This is tied directly to zoning policy, making it impossible to build basically anything but single family housing. That impacts the homelessness population very specifically by outlawing previously natural affordable housing, things like basement apartments, rooftop apartments, accessory dwelling units that we're only starting to re-legalize. A number of older housing stocks and multifamily housing stocks are non-conforming properties. So if they are aging, they're not allowed to be rehabilitated as multifamily. That means they get knocked down and maybe a big single family house comes into that. So we're making a lot of very active decisions to limit where we're building housing. Even multifamily housing in certain parts of the state that are allowed require a significant amount of land to have multifamily housing, which means it's going to be farther from transportation and other services. So even if you are in that lower economic stratosphere, you're not going to find that housing productive for you to get to jobs and get to services. And then the final act that I want to talk about is the impact that these zoning decisions are having on the climate crisis. Because as I see it, these are two crises, and the governor's mentioned this in his state of the state, that these are the same thing. We can't talk about them separately. Really what this means is we have aging housing stock that's capital A or lowercase affordable to the extent that exists. It's aging because it hasn't been allowed to be replaced naturally over decades. Second, we have a huge gap of the types of housing that we should have been building for decades that we don't. That means we are going to need to build a significant amount of homes just to address the specific crisis that we have today. And also, you know, putting that in the context of climate crisis, there are going to be places we can't build in this state to do that responsibly. So where do we find that land? Where do we find those opportunities to build a significant amount of housing we're going to need over the years ahead and decades ahead? That is absolutely going to be about zoning reform, absolutely about concentrating it in our cities, in our historic urban and suburban cores around transit. And that's expensive. So we're going to need a lot of interventions. It's not just one silver bullet on zoning. It's not just one silver bullet on RAP programs. We need all of it. We need it all urgency. So I'm going to stop it.
Thank you so much. Let me start with Representative Santiago, please.
Thank you, Madam Chair. A couple of points I want to make. And I know that the CBIA gentleman already left. But out of the 90,000 jobs that are available in the state of Connecticut with companies, I would like to see a list of companies that accept second chance folks for those jobs. It's second chance, you know, people that have a record are still having a difficult time contributing back to society and finding a job in the state of Connecticut because nobody wants to hire them. We have a job developer that works in Meriden, Wallingford, New Britain for Wheeler Clinic who is having difficulty finding employers to take second chance folks. The other problem that we have in the state of Connecticut is transportation. For example, in the city of Meriden, our buses come every hour. Very difficult for them to move around from job to job. I would like to see probably more employers dealing with transportation, maybe having a van or a small bus in order to pick up people that might want to go work in Sterling, Connecticut from Meriden or New Britain or the surrounding towns. I also want to bring up that homelessness is not only with the Black and Latino population, but we have in Meriden, we do have some Ukrainians and refugees from other countries that are also becoming unhoused. So that issue also needs to be addressed. I know we're trying to do things like in the legislature about credit reports, about how realtors and landlords really look at these credit reports and the costs of these credit reports, especially for people that are unhoused. And childcare, maybe we should be incentivizing employers also to have childcare in their buildings. Those are some of the barriers. I'm just talking about some of the barriers as the things that haven't been talked about. And also about zoning. In the city of Meriden, and I represent Meriden, we have affordable housing is almost up to 17%. And of course, the surrounding towns don't want to take the responsibility of housing a lot of developments with affordable housing. And that's a problem that we have all over the state with the suburbs. Nobody wants it in their backyard. You have the NIMBY issue that we have. And lastly, I want to also talk about that the Department of Housing does have a great program that we funded starting last year with the commissioner. And so far, from what I've heard, we've already housed 3,000 people that have bought homes in the state of Connecticut. So there are programs out there that people can go, but not everybody can become a homeowner. So affordable housing, supportive housing to deal with mental health and other barriers are the kind of housing that we need in the state of Connecticut. So that's all I wanted to mention. But I would like to, and I'll touch base with the gentleman from CBIA to see if any of those 90,000 jobs again will be accepting second chance folks for those jobs. So thank you, Madam Chair. That's all I wanted to make was a comment. And thank you for having this forum.
Thank you, Representative Santiago, and I can connect you with him if you would like me to. Representative Johnson.
Thank you so much, Madam Chair. And just quickly, I'd like to know how the vouchers market rates are developed and how they come to these conclusions, because they're not working in my district. I have students from UConn and Eastern Connecticut State University that can't afford the dorms, so they are renting bedrooms for $1,000 a month. So if you've got a 3-family house with 2 or 3 bedrooms, the landlord does make quite a bit of money. I don't know if these kinds of things are factored into how they do the vouchers. So thank you again for this wonderful presentation, these wonderful discussions. And wherever I can get that kind of information, I greatly appreciate it. Thank you so much.
Great. Thank you for that question, because we do believe that that's a place where there is an opportunity to make some impact. So the payment standards and the fair market rents that are able to be charged under the way the voucher system works, right, is that there's a determination made about what is a reasonable rent to be paid under that voucher. And then the family is charged roughly 30% of their income for the rent, and the voucher closes the gap. And so to ensure that the amount that the voucher is paying to close the gap is a reasonable amount, there are some determinations made about what is a reasonable rent. And those are typically based upon what's called a fair market rent. And there are ways in which you can take a fair market rent that is for a whole region. There are also ways in which you can set the fair market rent on a smaller area. And we think that there's a way in which we could set the payment standards within the state and also allow a higher percentage to be paid. So it can be set at 100% of fair market. It could be set at 110% of fair market. But there is some ability to have some flexibility there that allows allows the voucher to be more useful in more areas. And we do think there's an opportunity to make some change that will allow the voucher to be more useful.
Go ahead, Representative Weir.
Thank you. Want to thank you to all 3 of you, as well as to all the other panelists who are here today. We've covered a lot of topics. I can't even begin with the questions. We'll be here till 8 o'clock tonight. But I do just want to touch on, for the people who are here in front of me, talk about some of what I've heard so far. I look forward to having these discussions as we get through the session. Sitting on the Housing Committee, I know a lot of these topics are going to come right through our committee. But there are a lot of factors that go into somebody's developer's decision to develop and the area in which they're developing. So obviously we touched on zoning, touched very lightly on the environment, aquifers, open space, these areas that we've set aside to, give consideration to climate change. Those were all done. Some of these things have been done in the past, affecting the available land to build. We touched on interest rates, transportation, lightly, very lightly, jobs, and infrastructure. And I know my town of Hebron, we have an affordable housing project going on right now or looking to start. And one of the hindrances that has been lack of sewer and or usable water. And so that, right now they're drilling wells to the cost of over $1 million to get the right water supply. So I just want to point out that it's not a one-size-fits-all solution for the towns. I want to make that clear. We have, in my case, we've got a couple of towns. Glastonbury has affordable housing projects going on, not for lack of interest, but in some cases for lack of infrastructure. Bolton has zero water, or basically zero water or sewer. So it's not a one-size-fits-all solution. And the one thing that that I expect that we will touch on as we go forward. Nobody mentioned it today, but we talk about our regulations and, what's a deterrent and what is going to incentivize developers to come here and work here, and people who want to work here and stay here. It's the cost. One of the things I give great consideration to is the cost of living here, cost of our government, taxes, the spending, the regulation. These all have negative impacts on investment. And so I would look forward to having a discussion on what we can do to lower those regulations, lower those barriers, to invite people to come, want to stay, want to work, want to raise a family here, retire here, God forbid, with the taxes. So thank you for listening. I know we're going to have a robust session. Thank you.
Did you want to?
Just thank you, Representative, because you had so nicely highlighted the way in which there is no one single solution to the crisis that we're experiencing, but it really takes at all of these kind of approach, including investments in things like sewer infrastructure, which are also part of our agenda for this session, and hoping there'll be some investments made there. So certainly thank you for highlighting that issue.
And I'll just add, Representative, yeah, thank you for highlighting this as well. We agree there are a lot of factors that come into this, and the one size fits all discussion is a talking point that comes up a lot. And I 100% agree with you and anyone else that says that. I think the problem, to be clear, is right now we do have a one size fits all solution. As I mentioned previously in my statement, 91% of Connecticut's residential land is zoned exclusively for single family zoning as of right. That demonstrably is a one size fits all. And we know that sort of regime of sprawl, the single use, car centric, single family zoning is a one size fits all. That's really had a lot of bad, certainly environmental outcomes and economic outcomes. So what we're really trying to bring back into Connecticut, which historically kind of before the 20th century did have a lot of varieties of walkable villages, industrial cities, and hubs. We have that infrastructure and that bones in Connecticut already because we're an old industrial state. So what we're really trying to say is we need to increase that opportunity for that type of diversity of solution, public, private ownership, rentership, small property development, big property development, particularly protecting open spaces and our natural spaces, which is a really big part of trying to have this infill density piece around transit. So very much look forward to those conversations about this as well. And 100% agreement, it's not a one size fits all solution.
And I look forward to talks about incentivizing rather than put an unfunded mandate on our cities and towns. If these are initiatives that we're going to support, then we got to put our money where our mouth is. And also, what I hear a lot is talk about bringing these, changing what we're doing to the towns, but I don't hear a lot of discussion on improving the cities. We could have transit both ways, right? We may have people out in the suburbs and in the rural areas, incentivize them to come into the cities through safe areas, good schools, all those things I think would incentivize people. So I look forward to having this discussion going forward. Thank you.
You will be happy to hear that we are now number 2 on 2 different surveys for being the number 2 destination after Florida for retirement. I think it's because the climate's getting better. Or worse, as one might. I will find it for you. Representative Paletta.
Thank you, Madam Chair. And Ms. Dubois-Walton, if I may, I just have a quick question for you. You touched on transit-oriented development. I think that it's a very noble idea. In fact, members of my caucus proposed a bill last session in March about transit-oriented developments. We spoke at length about the need for them and how they can actually, in a positive way, affect communities that are in need of housing stock. And I'll just quote something that was said. It increases affordable housing stock by forming strong public-private partnerships with support from the state through financial incentives. Do you have an opinion on that and whether or not that's a noble idea that can be brought forward this session?
So we are a major developer of housing, and it is all through public-private partnership. I am a big proponent of the way in which we have created long-term sustainable communities that are communities of choice. And I invite anyone to come and visit us at New Haven and see how we've transformed what was formerly 100% public housing into these kinds of communities. It has all been done through public-private partnership in that way. So I'm a huge proponent of that. The expert on TOD is sitting next to me, so I'll certainly let Pete weigh in on more of that. But as we look at the range of solutions that I mentioned, as I talked about investing in our cities, I talked about investing in all of the things that unlock the potential to do development, and investing in how we protect tenants and residents and families along the way. That is absolutely a part of the equation.
And I'll just add, that very much appreciate the discussion about TODs, and it's absolutely crucial. It's one of the most popular polled policy solutions for the housing crisis and climate crisis. So it's great to hear. Obviously, I think this is a bipartisan issue to promote TODs, and not to turn this into a spin for work, live, ride, but this bill is very much intended to incentivize communities, coordinate with the state resources, help those communities that do want to grow. There are 111 communities in Connecticut that have some form of transit, from heavy rail to rapid bus to local bus service. And there's obviously variations of that continuancy or whatever, but that's a lot of communities that really do already have those bones and infrastructure in place. Even more specifically, there are about 50 communities that either have already planned past some kind of TOD district that have been very successful, or they have plans, whether it's a COG, whether it's a consultant, or sitting on things like water and sewer infrastructure, brownfield remediation, stuff the state actually does have money for, but it's not being coordinated. It's hard for those local folks in the economic departments or planning departments or zoning boards to get those resources. So that's certainly our approach for Work, Live, Ride, but we're really encouraged by that comment from you and look forward to those conversations.
And thank you. And I guess it goes to the funding, right? And what you touched on was the state has the resources. They haven't necessarily expended them in that area. So there have been proposals put on the table. Unfortunately, they haven't been acted on. And if there's money to clean up brownfields, if there's money for TODs, and it's been proposed, then why haven't we done anything? And I think to simply suggest perhaps that a municipality itself doesn't want this is, I don't think it really has a lot of placement here. I think what it comes down to is there is an opportunity for a public-private partnership with the correct funding, just hasn't happened, hasn't been acted on here. And it certainly hasn't correlated into anything locally, because you all wouldn't be here if we didn't have a housing crisis. So I think we should act on that proposal. I think we should look into it. It was put forth, it was accepted by a number of legislators, and it never went forward. It's very concerning to me. So I hope maybe we'll have better luck this session. Thank you.
I would say that I think we have a lot of proposals that are good to get put forward that unfortunately end up on the chopping block. So we'll see. We'll see. It is a short session, and you know how that goes. I think at this time, I'm just going to double check Zoom, but I believe we are at the end, and thank you for hanging with us. We went an extra half hour. I just want to provide some final comments on this, because I am so grateful to all the panelists that were here today. I think that it was probably shocking to some of my colleagues to hear the numbers about homelessness that are around our state. While Representative Case did not share it today, he has frequently said, he has over 100 people living in the woods near his district or in his district. And we are continuing to have these conversations, but as Representative Paletta just said, we need action, correct? So that's what I hope is going to come out of this. I will just share a couple stories with you. I have been working with a woman, with a friend of mine, who was offered a tent for her and her 1-year-old back in September. The day she was offered the tent was 46 degrees and it was raining. For those of you who are not aware, that's a day that you could get hypothermia if you're sleeping outside. Now picture trying to keep a 1-year-old warm inside of a tent on that same day. We have had situations where we call 211 and the wait times are 86 minutes long. If you're still a person who is paying minute by minute on your cell phone, that is not only unconscionable, it's completely unaffordable. You can't stay on hold for 87 minutes only to be told that, well, you're not homeless enough. So I was glad to hear the commissioner say today that they're going to work on that as well. And just personally, I would share, as we discuss all of the options, affordable housing, workforce housing, infill housing, we have, housing around transportation, whatever it is today. I was raised by a single mother. I'm sure there are many others in the legislature who were also raised by single moms or dads. And by the grace of God, my grandparents were willing to take us in. We temporarily lived with them for 8 years. That's a very long to be in temporary housing with anyone, let alone, thank God, my grandparents. But I bring that up because I did not grow up in Connecticut. I grew up in a state that has county government. And I think that at the time, you know, they saw the need and it was outside of metropolitan city. They made sure that there were a variety of housing. The housing that we moved into was a townhouse. When I moved here, I was shocked that there really wasn't that thing, such a thing as really townhouses. It's, you know, that sort of part of that missing middle that we talk about. I bring this story up because I can remember so clearly the shame that I felt and didn't know why as a child when we went to visit my cousins in New Jersey and they said, "Oh, you're going to live in row housing." I didn't know what row housing was. That's more of a Northeast thing, right? That was not a thing in Virginia or outside of the DC area. But I knew that there was some sort of shame attached to that. Whereas I was just so excited because my mom and I were moving into this brand new space that was going to be just for the two of us and how exciting that was. I think about every single day, these families, especially these moms and dads who are out there on their own, or the moms and dads who are out there together with these children, 27 children that are sleeping outside in Fairfield County alone currently. So that means when we had a foot of snow over the weekend, those 27 children were outside with their families this past weekend. For us to continue to come up with barriers, I admit that we do have barriers, whether it is zoning or other regulations or, you know, impediments to building. But for us to continue to throw up additional barriers to building is unconscionable, not just for the people that are currently living outside and not just for the people that are currently living in shelter, but for our seniors who cannot downsize because there's nowhere to go, even though we love to talk about how they'd like to get out of their houses. Where are they actually going to go? For our college graduates who are trying to get their start in the world and who we certainly want to retain here, and we're doing a better job of that, but not a complete job. For our parents with adult disabled individuals who are saying we don't have enough housing for our disabled adults who are not allowed to, but are able to live independently. For our young couples who are thinking about starting a family, while our one panelist did not have that experience, I can tell you that all of the young couples that I work with in this very building will tell you, oh yeah, we put in 10 different offers and then maybe they finally have gotten something or they gave up and they just had to stay where they were. So we cannot continue to throw up barriers. It was why I wanted to get all of these committees today to talk about this. But I will tell you, as someone who was so proud of that moment when we were able to move in that house, and I can picture the joy and excitement, not just of my mom, but of our family to have that moment. Whether it's renting or owning, it is our responsibility to put more people in homes. It's not just houses to folks, it's homes. And so I hope that what we're taking away from today, and I hope that my colleagues who watch this after the fact or our general public that watch this after the fact, that you are stepping up and saying, you know what, we do need more housing, that you are yes to in my backyard. And that you are thinking about how you can work with your towns and with your legislators to move all of this forward. So I thank you so much to my colleagues who sat through 2.5 hours today and to all the panelists who were in the same position. Thank you so much for your time today. And with that, we'll finish. Thank you. Thank you.